But
Okay.
welcome everybody. My name is Marty Mascari. I'm a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC, both of which are part of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We're blessed to have Donnie Green, who is the director, here to talk about resources for people leaving rehab or nursing facilities in Texas. And Donnie's already covered the CEUs, which is the next slide. Are you able to advance that, Donnie? Let's see.
Apparently I can't,
Okay,
so I can
it's
advance it on my screen, but I don't think you all are seeing it
yeah, we're not.
on your screen.
Um,
Okay.
we're not. Okay, hold on, let me. For some reason, it's not wanting me to do it. There we go. So one more. There you go, Donnie. It's yours now.
Very good. All righty. So thanks again for bearing with us. And Marty, we can go ahead and go to the next slide. So this morning I'm going to be covering four topics. I think I should have time to respond to questions and answers at the end of the program, but in the interest of making sure that we cover all of the content, we won't address the questions until I've concluded the formal remarks. So the four topics that I'll be discussing this morning include home by choice nursing home relocation services for nursing home residents who have Medicaid benefits. A second topic, Aging and Disability Resource Center, or ADRC, options counseling services for residents without Medicaid, as well as people who are in hospitals, emergency departments, rehabilitation facilities. The third topic consists of area agency on aging services for people who are at least 60 years old and qualifying family caregivers. And then the last topic will consist of dementia-friendly services for family caregivers of people with dementia. Marty, we can go to the next slide. So let me start with the Home by Choice Nursing Home Relocation Program. And if you're not familiar with the Promoting Independence Initiative, it is Texas' response to the Supreme Court decision of the Olmstead decision of 1999. And that decision held that Medicaid beneficiaries who are in institutional settings, including nursing facilities and state-supported living centers, have the right to receive community-based care if that care is sufficient to meet their needs. Now, I'm probably a lot older than you all, but I do remember the days prior to 1999 when people in nursing homes would have to wait months and sometimes years in order to receive community-based care. So the Olmstead decision was really a game changer, not only for Texas, but for the rest of the country. So the supports that are available to people in nursing facilities include Medicaid waiver services. And those include the STAR Plus waiver. That's the waiver that I'm most familiar with. But there are a number of other waivers that may be available to people who are in nursing facilities. They include the Community Living Assistance and Support Services waiver, or the CLAS waiver, um, for persons with intellectual and developmental disabilities, as well as the Home and Community Services waiver, or HCS waiver. And I did want to clarify that this content is specific to the state of Texas. So for people who are joining us from other states, the waiver programs would be known by different names. The benefits would be different. Texas is a managed care state, so in addition to being eligible for those Medicaid waiver services, nursing home residents would also be eligible for service coordination by the Medicaid managed care organizations. Those would be WellPoint, formerly known as the Mara Group, Molina, Superior, United. In addition, nursing home residents with Medicaid benefits will also be eligible for intense case management services by a relocation contractor. And so within the North Central Texas Council of Governments, we manage the Home by Choice Nursing Home Relocation Program for the greater Dallas-Fort Worth area. And in other parts of the state, there are relocation contractors providing that same scope of work. And I'll share some information about who those relocation contractors are. Residents with Medicaid benefits who are interested in returning to the community may qualify for two different transition grants. They include the Transition to Life in the Community grant and the Supplemental Transition Services grant. Both of the grants have a maximum value of $2,500, and the grants can be used one time only. So if somebody receives a transition grant of $500 or $1,000 or $1,500, they are not able to access the transition grant again. And the purpose of both of these transition grants is to help people establish their community residence. And yes, the presentation will be provided to you all. So transition to life in the community is intended to help out with essential goods and services, including rental deposits, utility deposits. Transition to Life in the Community, or TLC, can also pay for essential furnishings, a bed, a chair, a sofa. It can also help with moving expenses. The TLC grant is not available for those moving to congregate living arrangements. So if somebody is transitioning to an assisted living facility, he or she would not be eligible for the Transition to Life in the Community grant. However, the Supplemental Transition Services grant would be available to people who are moving to assisted living facilities, group homes, as well as to family homes or rental units as well. So supplemental transition services can pay for all of those same things that can be covered by Transition to Life in the Community. But it would not pay until somebody had maxed out the Transition to Life and Community grant. So supplemental transition services can pay for rental deposits, security deposits, utility deposits, essential furnishings, can also help out with startup groceries and clothing if somebody has, gained or lost a lot of weight while being in a nursing facility. The Supplemental Transition Services, or STS grant, can help out with those kinds of things. So people can and do get approved for both grants at the same time. So assuming that somebody would max out both grants, the maximum grant value would be $5,000, but most people receive a lesser amount through these grants. And to Texas's credit, it's one of the few states that I'm aware that makes those transition grants available, and they can be very, very important in terms of helping people establish a community residence, as well as kind of covering the basics at assisted living facilities that would be beyond the facility's responsibilities. So through the Home by Choice Nursing Home Relocation Program, the relocation contractor would help the resident kind of evaluate different housing options and determine the preferred housing arrangement. And through the Home by Choice Relocation Program, um, the resident can move back home if he or she has an established home that's still available. The program can move people into family members' homes. It can help them in terms of transitioning to assisted living facilities. that participate in the Medicaid program. And it can also help people in terms of getting approved for housing vouchers and finding a landlord that will accept those vouchers. And the two primary programs that the relocation program helps people coordinate are the Project Access and the 811 housing voucher programs. So in terms of finding assisted living facilities that accept the waiver, probably the best source of information is going to be the Medicaid managed care service coordinator. Plans add new facilities to their contracted providers. They may drop facilities or facilities may pull out. So the managed care organizations are really the best sources of information when it comes to determining those that contract with the Medicaid program. All righty. And so let me talk a little bit about the difference between those two programs. Project Access, you're probably not familiar with that program because it is intended to serve special populations only. It's not available to the general public, but one of the populations the program is intended to benefit are people with Medicaid who are in nursing facilities who wish to relocate. And the beauty of the Project Access program is it issues vouchers that are good for a lifetime. So as long as somebody continues to comply with the terms and conditions of their lease, they can receive that assistance. They can move to another property that will accept the Project Access voucher, and that housing subsidy will follow them. So in terms of providing kind of broadest choice, the Project Access program is generally the more preferred of the two programs. Section 811 is different from Project Access. So Project Access is a tenant-based program. It issues a voucher to the resident who's able to use it with any landlord that will accept the voucher. Section 811 is actually a property-based program. And so if somebody relocates through Section 811, he or she would have to go to a property that has a subsidy available. And if for any reason the tenant wanted to move to another facility, at that point he or she would lose that housing subsidy. So the rental assistance is tied to the property, which, can be a disadvantage for some people. In addition, the eligibility criteria for 811 are more restrictive, certainly in terms of age. So the person has to be under the age of 62 when he or she moves into the property. And then again, as long as that person remains at the property, the housing subsidy would be available even when the person, reaches the 62nd birthday and beyond. And and we've run into situations where we've helped people apply for the Section 811 program. They were under the age of 62 when we started the process. Unfortunately, they turned 62 before a unit became available, and at that point, they lost their eligibility for the program. Marty, if we can go to the next slide. So in terms of eligibility for home by choice nursing home relocation services, the person has to have Medicaid benefits, has to be residing in a nursing facility, and has to be enrolled in a Medicaid managed care organization. Again, Molina, Superior, United, WellPoint. In terms of estimated wait time for a voucher, it varies a lot. But generally, we're seeing it take a year, 2 years to pull that off. Sometimes quicker, unfortunately, sometimes slower as well. Sadly, that's generally less time than it would take for somebody in the community to get a voucher. We're seeing wait lists through most housing authorities of 2 years, 3 years, and more. So in terms of making a referral for a nursing facility resident who has Medicaid benefits, really the best strategy is to contact the managed care organization, a service coordinator who is assigned to that facility. Alternatively, a referral could be made to the relocation contractor. In the greater Dallas-Fort Worth area, it is my organization, the North Central Texas Council of Governments, but in other parts of the state, it is generally the Center for Independent Living. So in the greater Austin area and other parts of the state, it's Arsol. In the San Antonio area, it's Coyle. In the Harris County area, it's the Houston Center for Independent Living. And in West Texas, it's Liferun. So if you need that contact information, we will make these slides available, and it does have my contact information. I'd be happy to get you more detailed information. So, now I'm going to move from relocation services for nursing facility residents with Medicaid to Aging and Disability Resource Center options counseling services, and these are available to residents, nursing facility residents without Medicaid benefits. So those can include people whose stays are funded by Medicare, um, those whose stays are covered by Medicare Advantage plans, private insurance, self-pay, and charity care. And these options counseling services are more broadly available than the home by choice relocation services in that they're also available to people who are discharging home from rehabilitation facilities and hospitals, and even those who are being treated in emergency departments and may be at risk of premature nursing home placement. So that's kind of the beauty of the ADRC options counseling program. Very, very widely available. However, the nature of the supports are more limited, which is kind of a good segue to our next slide. So through the Options Counseling Program, the Aging and Disability Resource Center staff will provide information about and referrals and connections to federal, state, and local programs. So the options counselors are going to be familiar with services through the Area Agency on Aging. In some cases, the staff are fellow employees in the same agency. Again, my agency administers an Area Agency on Aging, an Aging and Disability Resource Center, and a home by choice relocation program. We're somewhat unique in doing that, but there are many other parts of the state where the Area Agency on Aging and Aging and Disability Resource Center are part of the same host organization. The options counselors will also have familiarity with services through the Veterans Administration, will connect people with their county veteran service officer, will provide general information about VA programs that may include aid and attendance. And I love aid and attendance. It's not widely known, but it's a program that will provide an additional pension to those who qualify that can pay for care in the community, in an assisted living facility, and in a nursing facility. And it's also one of the most permissive programs when it comes to paying family members as providers. One of the very few programs that I'm aware of that will allow spouses to be paid providers as well as children. The options counselors will also be familiar with services through the Health and Human Services Commission and can screen people to see if they qualify for community attendance services, and other services through the state of Texas. So home delivered meals and um, family care services and adult day activity programs and so on. And then the options counselors will also be familiar with programs at the state or local level that may not be publicly funded, um, but can serve people who don't qualify for services through public benefit programs. So one of the programs that we've supported for years and years is Texas Ramps, which is an all volunteer organization that, as the name suggests, builds ramps for those people who can't afford to pay privately and don't qualify for Medicaid waiver programs um, that that may be able to perform accessibility related modifications. Through the options counseling program, the staff person can also discuss eligibility for nursing home Medicaid services. Those of you who are employees of nursing facilities, you're likely pros at these conversations. But for those of you who don't work at a nursing facility and don't live in the weeds of Medicaid programs, it can be very, very confusing trying to help people understand the income limits, the resource limits, as well as the medical requirements for nursing home Medicaid. And a lot of times we are counseling people who've been in rehab facilities under their Medicare benefit. They haven't fully returned to their baseline. They need some additional supports, and they're trying to make a decision very quickly about whether to remain in the facility for the purpose of making application for nursing home Medicaid as opposed to returning to the community. So this publication provides information about all of those Medicaid requirements, the income, the resource, the medical, and then it also includes information about protections for spouses. And that's where it can be really, really difficult to understand the financial requirements for nursing home Medicaid. And so through the Aging and Disability Resource Center team, kind of working in collaboration with benefits counselors through the Area Agency on Aging, we can provide objective information to support that decision, whether to remain in the facility or return to the community. Through the Aging and Disability Resource Center, we also have a lifespan respite program. So those of you who are with facilities or working with patients who may be discharging from facilities, please keep this program in mind. The beauty of the program is, again, pretty broad eligibility criteria. So the hard and fast requirements are that the caregiver has to be a family member related by blood or marriage. That person cannot be paid as a provider, so can't be paid by a Medicaid waiver, can't be a host family who's being paid for providing care. And beyond that, the caregiver just has to help us understand why it would be difficult or impossible for them to pay privately. So it's a very, very flexible benefit. It is structured differently in different parts of the state. Here in North Central Texas, we issue vouchers, and those vouchers can be used to pay for care from agencies or individuals to give that caregiver a break. So we have some people who will pay other family members to come into the home and kind of free them up so that they can go on vacation or take care of their own medical needs. They can also take those vouchers and make arrangements with adult day activity centers or assisted living facilities, or we've had a lot of parents of children with special needs who've used the vouchers to pay for summer camp for their children. So um, again, the beauty of the program is it's flexible in nature. The flip side is it's typically one time a year and a limited dollar benefit. So here in North Central, it's usually somewhere between $975 and $1,500. Again, do keep in mind that different parts of the state will structure their lifespan respite program differently. Through the Aging and Disability Resource Center, we all are required to develop an inventory of affordable housing. And Marty Mascari, who is hosting today's webinar, wears many, many hats with the North Central Texas Council of Governments. In addition to hosting these webinars, he is also our housing navigator. So Marty and his peers in other parts of the state are gathering together information about different housing properties and resources for affordable, accessible, and integrated housing. And so through our ADRC website, which is www.nctadrc.org, you can go to the housing information and search that inventory by type of property, by city, by county. And then Marty's got information for independent housing. He's got information on resources for people who are homeless. He's got a tab on assisted living facilities as well. So in any part of Texas, to reach the Aging and Disability Resource Center and the Options Counseling Program, you can call 855-937-2372, and you'll be prompted to enter the zip code, either for you if you're calling for yourself, or if you're calling for a resident, a patient, just enter the zip code of that resident or patient's home, and it will route you to the Aging and Disability Resource Center that serves that area. Alrighty, now I'm going to move to kind of a very broad overview of services through the Area Agency on Aging. And with the Area Agency on Aging services, there's quite a bit of variability in different parts of the state. All parts of Texas, all parts of the country are covered by area agencies on aging, but each one is a little bit different. In Texas, there are certain services that all of us must offer, and then there's a long list of services that we can support if we see it as a regional priority and if we have funds that are available to support. But let me start by just talking about eligibility in general. So to qualify for services through the area agencies on aging, the person must be age eligible. So for the services for older adults, more specifically, the person must be at least 60 years old to qualify. So I'm a gerontologist who has absolutely no sensitivity when it comes to my own age. And I'm proud to announce that for a few months, I've been eligible for the programs that I administer. So it took me about 27 years of working with the programs before I finally reached that milestone. But by golly, I am there. So, so again, age is a necessary criterion, but priority is given through the area agencies on aging to certain high-risk populations, and they include older adults with greatest economic need. So as you look at people who receive ongoing services through the area agencies on aging, a disproportionate share are living in poverty. We also give priority to those with greatest social need, those who are frail, and even more specifically, those who are at risk of premature institutionalization. Um, and as we think about premature institutionalization, we believe that people who are in hospitals, rehab, nursing facilities, they're really at the highest risk of premature institutionalization. We're also asked to give priority to those who live in rural areas and those with limited English proficiency. So with some services, we are asking a series of questions so that we're giving priority to these population groups. And that's particularly true if we're going to be paying for things like utility bills or rent. Those programs um, are gathering information about financial need to effectively target older adults who are experiencing greatest economic need. So let me talk a little bit about how these services are funded. They're funded by federal grants. So those of us who've paid taxes, we've supported these programs. They are not funded by insurance. And so as a result of that, um, we don't we typically don't ask questions about insurance unless somebody is requesting a service that may be funded through Medicare, Medicaid, or a private insurer. For example, um, through our temporary case management program, we can pay for durable medical equipment that's not covered by insurance. If somebody contacts us, has Medicare, and says, I need a hospital bed, or I need a wheelchair, a walker, we would talk them through the process for accessing that equipment through their insurance. And we would be paying for things that are not covered. We would be paying for the elevated toilet seats and the handheld shower nozzles, or we can pay for, the wheelchairs and walkers for those people who don't have Medicare or Medicaid benefits. All righty. Marty, if we can go to the next slide. So, as I mentioned, there are some services that all area agencies on aging must fund, and those include information and referral. So, if you or a patient or a family is casting about for a social service program, give us a call. We'll do our best to determine if there's a federal, state, or local program that may be able to meet that need. All of us are required to have benefits counseling services, and we use both staff and volunteers who have received pretty intensive training in public benefits with primary focus on Medicare benefits. So they can help people understand what Medicare will cover. They can help people do plan comparisons, determine whether they want to receive their Medicare benefits through traditional Medicare versus Medicare Advantage plans. They can screen people to see if they qualify for Medicare savings programs and low-income subsidies. They can help people with applications for those savings programs and low-income subsidies. And in some cases, they can also help people in appealing denials of Medicare coverage as well. All of the area agencies on aging are required to support nutrition programs, and the two nutrition programs that we administer are the home delivered meal or Meals on Wheels program. That's by far our largest program. In North Central Texas, we pay for about 1 million home delivered meals each year. We also pay for meals that are served at senior centers, and we refer to those as congregate meals. All of us are required to have case management services, and these are temporary services. Generally, provide help for somewhere between a month and 5 months. And through the case management program, the Area Agency on Aging can pay for services that may include homemaker, personal assistance. The area agencies on aging can pay for minor home modifications. The most common types of repairs would be installation of wheelchair ramps, grab bars, in some cases, widening of bathroom doorways. Other agencies on aging may be able to do other types of repairs, but generally the accessibility modifications will be the primary focus. And the area agencies on aging are also able to pay for medical goods and supplies not covered by insurance. So those may include incontinence supplies, nutritional supplements like Ensure and Boost, um, and so on. The area agencies on aging will administer or contract out for the long-term care ombudsman program. And that program can advocate for people who are in nursing as well as assisted living facilities. The program can also provide objective quality information to help people make informed choices if they're thinking about placement. So the long-term care ombudsman program will never say, you know, Miss Jones, you need to get admitted to facility ABC, but we can let people know how well facilities have done during their most recent surveys. We can share de-identified objective complaint information. We can let people know which facilities participate in the Medicaid, the Medicare program, and so on. The area agencies on aging are also required to have what are called evidence-based programs. And that just means that they're programs that have been proven to be effective on the basis of research. The most common types of evidence-based programs that are offered by the area agencies on aging are a matter of balance. And that's a small group program that teaches people how to reduce their fall risk, how to exercise to build balance and flexibility, and how to overcome the fear of falling. Um, and then many area agencies on aging, including ours, offer the chronic disease self-management program that teaches small groups of people how to develop plans for better managing their ongoing conditions. Some area agencies on aging will have these programs that specialize in diabetes and chronic pain. Some area agencies on aging, particularly those in the Metroplex, also offer evidence-based programs for older adults who are dealing with depression as well. Just keep in mind that there's going to be a lot of variability at the local level when it comes to those evidence-based programs. Optional services that can be funded by the area agencies on aging, but are not required include demand response transportation. So in North Central, we fund some transportation services. Area agencies on aging can pay for personal emergency response services, adult day activity programs, instruction and training programs for older adults, caregivers, professionals who are interested in learning how to better serve older adults. Counseling, again, is going to be one of those optional services. We fund it as an evidence-based program. And this is not a complete list. There are probably 10 or 15 other services that an area agency on aging can fund. But these really are the major programs that area agencies on aging would choose to support throughout the state of Texas. Now I'd like to turn from area agency on aging services for older adults to those area agency on aging services for family caregivers. So under the Older Americans Act, area agencies on aging can provide caregiver services to people who care for a family member who's at least 60 years of age, as well as a family member of any age who has dementia. In addition, if we go to the next slide, people can also qualify for area agency on aging caregiver services if they're at least 55 years old and they live with and care for a relative who's between the ages of 19 and 59 and has a severe disability. So we would be able to provide caregiver services to somebody who's 57 years old and caring for an adult child with disability, who's caring for a spouse with disability or caring for another family member who's related by blood or marriage. We can also provide caregiver services to people who are at least 55 years old and live with and have primary custody of a grandchild who is no older than 18 years of age. Um, and it's not necessarily limited to grandparents. We're just not able to serve parents of minor children. So we support those other family members who are kind of stepping in and assuming the parental role. So with caregiver services, again, lots of variability. But as we look at the state of Texas, by far the service that's most widely available would be the temporary case management program. So that's the program that can pay for the in-home services, including respite care, can pay for the durable medical equipment and the minor home modifications and so on. Area agencies on aging can also support counseling and support groups. Here in North Central Texas, we've chosen to do that. We work through local partners, including the Alzheimer's Association. And then area agencies on aging can choose to support webinars and workshops. And that's actually how we're making today's program available to you. We have chosen to invest in community education, and Marty Mascari is our partner in terms of organizing and hosting the programs. If you'd like to make a referral to your area agency on aging, you can call 1-800-252-9240. This is a phone number that will get you connected if you're in the state of Texas. So this will not be the go-to number if you're from another state. And again, what you would do is enter the zip code for the person you're concerned about. So for your family member, for your resident, for your patient. Okay, the last topic that I'd like to cover, and this will only take a couple of minutes, is our dementia-friendly services for family caregivers. And the reason I'm including it in today's program is even though this is a grant that was given to the North Central Texas Council of Governments, these caregiver support services are available to family caregivers of people with dementia statewide. And in fact, we can go beyond the state as well. So if you're from another state, to know of somebody who could benefit, the more the merrier. So there are a few programs that we are supporting through this grant. The first is Dementia Live Training, and that training is done by our partner, James L. West. Those of you who've attended other webinars by Marty, you're probably familiar with Jamie Cobb and Holly Glover with James L. West. And that Dementia Live training is just a short workshop that lets people simulate the dementia experience. The training is available virtually as well as live for people who are in the Fort Worth area. But again, anybody throughout and beyond the state of Texas who's interested in that program is free to participate. James L. West also does a 1-hour training program called Compassionate Touch, and that teaches family members how to use touch to calm somebody with dementia who's agitated. And then we recently developed capacity to provide resources for enhancing Alzheimer's caregiver health, or REACH. Really neat program that assigns a dementia educator to the family caregiver, and the family member identifies kind of the 2 or 3 top stressors or needs, and that dementia educator provides one-on-one education and support generally over the course of 6 months. So if somebody is concerned about responding to challenging behaviors, the dementia educator can kind of help the person problem solve with whatever issue that they may be dealing with, whether it's wandering, refusing to take a bath, getting agitated, hallucinations, delusions. So that program is available to family caregivers throughout the state of Texas. And we have a dementia educator who provides the service in English, as well as one who provides that education and support in Spanish. And again, you all will be receiving copies of these slides for the contact information. So that actually brings me to the end of my remarks. I've provided you my phone number as well as my email address. And I think in the 10 minutes that we have remaining, I know that there were some chat questions that I did not respond to. So let me see if I can pull those up, and I'll just kind of work from oldest to newest. Okay. Um, Great information. Do you know of any Medicare Advantage plans that provide aid and attendance services? Unfortunately, I do not, but huge caveat, I'm not a benefits counselor. And the benefits counselors may have that information. So Medicare Advantage plans can offer supplemental services, and those supplemental services may include aid and attendance services, but I would say that's probably a good place to start. Call the area agency on aging, ask for the benefits counselor, see if the benefits counselor is aware of Medicare Advantage plans that offer those as supplemental benefits. Okay, so that's my first answer. That's sadly not a full answer. Okay. Is there an income test for Medicare beneficiaries? And Sammy, are you asking about the area agencies on aging? If you are, no, there's no income test. Here in North Central, we do give priority to people who are living at or below 150% of the poverty level for our case management program. But we can and do serve people with higher incomes. We're just looking at kind of the totality of what's going on. We're not only targeting those with financial need, we're targeting those who are frail, who have limited family support, who've been through care transitions. So long answer short, there is not an income test for Medicare beneficiaries, but as area agencies on aging are being asked to pay for utility bills and rent, they will ask for some information to be able to document that there's financial need. Oh, for the lifespan respite program, no, there is not an income limit. Again, we're just asking a series of questions to be able to document that there's financial need. In North Central, we don't authorize um, a number of days or number of weeks or months. We just say you've been awarded X dollars, $975 or $1,500. The family caregiver is able to choose his or her own provider and negotiate whatever rate he or she thinks is fair. So some people will pay a family member $10 an hour. Some will go to a therapeutic horseback riding program and they may pay $100 an hour. We just let that family member decide how they want to use that voucher benefits. That voucher benefit. Okay. All righty. Let me
There's
go
a bunch of
back
them.
here. Yeah. Um, okay, website for housing. Marty's dropped that in the chat. Thank you, Marty. All righty. Keep scrolling down here. How quickly is DME accessible through the AAA? I can speak only for North Central. So we do have 2 weeks to do an assessment and develop a plan of care. Beyond that, it generally takes us maybe a couple, 3 days to get the equipment ordered. And it usually takes, a couple, 3 days beyond that for it to be delivered. So I would say in general, it's about 3 weeks through the North Central area agency on aging, but just keep in mind that everyone is different. And, sometimes it goes faster, sometimes it goes slower. would you be able to cover equipment if the patient needs a replacement of an item? So yes, so if the person needs replacement and it's within our budget, we can do that. I'll give you an example. Um, somebody's walker was stolen. Somebody's wheelchair was run over. And yes, again, we just can't pay if that person is eligible for the service through a public benefit program. So we would just need to document that, the person has Medicare benefits, but Medicare declined, or the person has Medicaid, but Medicaid declined. Okay. Yeah, and thank you, Maria. Yes, 3-in-1 bedside commodes are being covered. So not a good example, but the elevated toilet seats, the transfer benches, the shower chairs, those are the kinds of things that we're often paying for. AAA core services, do they have to have Medicare or Medicaid? Absolutely not. So we can work with people who do have Medicare and Medicaid, and we'll provide them services. Again, we just can't pay for something that would be covered through Medicare, Medicaid. We can pay for people who are well insured, but maybe they need something that's not covered by their insurance. For example, most insurance plans will not cover the grab bars or um, the shower chairs or transfer benches. We can also work with people who are uninsured. And in fact, through the Older Americans Act, you don't even have to be a legal resident in order to qualify for services. So, we are serving people who are uninsured for various reasons, but again, through our case management program, those are temporary services. So we are not able to provide those in-home services beyond just a few month period. Okay. Yes. Um, we are happy to try to get chronic disease self-management classes to the minimums, and we'd be happy to visit kind of one-on-one and on how to make that happen. Personal emergency. So again, that's an optional service. It is one that we fund in North Central Texas. Not all area agencies on aging do fund. And yes, so we are referring to the Life Alert button. We do fund those on a temporary basis, generally for 5 months. And we can pick up the copay, even if somebody does have coverage, but they can't cover the copay. We in North Central will consider that, but not necessarily all area agencies on aging will do that. Every time I call the AAA for caregiver services, it seems they are not accepting new referrals or are out of funds. I believe you. And again, every area agency on aging is different. What we do in North Central is we've developed screening criteria. We don't have a wait list, but not everybody who calls will qualify because of our screening criteria. So we either say, yes, you qualify, and we get the process rolling, or we say, regrettably, you don't meet our screening criteria. You don't qualify for services right now. And, to the extent we can, we'll say, here are some other services some other resources that may be available to you.
Tony, it is 11. Do you want to go
Mhm.
ahead and cover the CEUs stuff again
Yes.
real quick?
Hmm.
And then, um, so if we could advance it. Oh, that's you
Yeah,
advance this,
and it
and I'm
looks like there
sorry.
are an awful lot of questions about
Yes.
incontinence. So different area agencies on aging will handle differently. Some will not fund, some, if they fund, will fund one time only. Okay, so just a reminder in terms of CEUs so that we can get you guys onto your next meeting if you've got a hard stop. So they are available for licensed social workers and licensed professional counselors. This program has been approved for 1 hour of continuing education units. You must complete the entire webinar. When you exit out, you should see a pop-up to the Google survey evaluation form. You'll also be receiving a survey link in the follow-up email. And Marty, I believe that that will have the slides or a link to the slides. That evaluation link will only be available for the next 2 weeks. And Marty will be issuing certificates by April 1st. So it does take a while for him to just kind of move through those steps.
And then if you could advance it one more time and we can talk, just let them know about the next month.
Okay.
We've started working
And
with
Marty,
the,
I've kind of lost my
oh, I'm
ability to
sorry.
advance.
I'm so sorry. I'm used to the other, I'm so sorry. Okay, so next month, we're going to be doing a series with Donnie. And so next month, we're going to be on the 28th of March, Thursday, and it'll be intellectual disabilities and dementia, an overview for professionals. It is an overview for professionals. I am so sorry, but anyone's welcome to join us for that.
Yeah, family members as well. Yeah, it's kind of a niche topic, but if you know anybody who has Down syndrome in particular, um, you'll you'll probably take interest in this topic, and certainly, you know, other types of conditions as well. So Marty, for those people who want to stay and have asked a question that I haven't responded to, I'm happy to go back to others in the chat, or do you have a hard break? Do you need
No,
to?
I don't. I do not have a hard break.
Okay. So let me go back to chat and see if we have other questions. Um, Portable ramps, some area agencies on aging can do that. That's certainly something we in North Central would consider. Any programs for transportation, again, the area agency on aging can choose to fund transportation. Here in North Central, we do. Through the Aging and Disability Resource Center, we'd also be familiar with public transportation programs, sometimes with private programs as well. Okay, transportation, and then oh, just nice comments. Thank you, thank you, thank you. Okay.
There's a few in the Q&A too, just so you know. I'm sorry.
Okay. Project Access, that is a program that the relocation specialist would have to apply for. And again, do keep in mind that in order to qualify for Project Access, it would have to be a Medicaid resident of a skilled nursing facility. Okay, I think, let me go over to Q&A. What are the requirements for Aging and Disability Resource Center? Really next to none. So the Aging and Disability Resource Center can provide information to people of all ages with all types of disabilities and their family caregivers. In terms of the respite program, again, different aging and disability resource centers will structure it differently. For ours, you just have to be an unpaid related family caregiver who is not receiving similar services through another program and would not have the ability to pay privately. Okay, for those individuals in their early hospice diagnosis, you know, that's probably worth a one-on-one conversation. I'm not sure if you're looking for what type of services that you're interested in, but probably best just to call the Area Agency on Aging so that we can do a better job. And no, you do not have to be a USA citizen. Marty, are you seeing
That's
any other questions that I haven't?
outstanding. Um,
Okay.
Outstanding, Donnie. Thank you so much.
Well,
I,
I certainly
I,
want to express my gratitude to Marty for organizing and all of the folks who've participated today.
Great. You all please look for the follow-up email that will go out tomorrow, and it will have again the link of the slides that I put. You should have found those in the webinar with your login information, but if not, you get those in the follow-up email, and I've also have them in the chat here. But also links to register for next month and some other webinars we have coming up as well. Donnie, thanks again. Thank you. Thank you.
You bet. And Marty, can I just answer Maria's question real
You go
quick?
right ahead.
So Maria, it would probably be the relocation contractor if it's somebody in rehab. But if it's a person with Medicaid, just give us a call. We'll try to see if we can get them qualified. Just keep in mind that the relocation is for nursing facility residents with Medicaid. Options counseling is generally for those people without Medicaid.
And you saw
Okay,
where Reach is it Terrell from
Sherelle.
Reach, her contact information for incontinence supplies
Excellent.
and stuff.
Yeah.
If you see that, I'll get that information and put that in the follow-up email as well for y'all. Thank you all so very much. Thanks for joining us. Please look for next month. Help us spread the word. And this recording will be put up. It'll be a couple of weeks at least, but we'll get this up on the YouTube channel as well if you want to share that with anyone else. Thanks and have a wonderful day.